Welcome to the RVU OMM Mechanisms of Action series. This edition will look at the proposed mechanism of action of general osteopathic technique. To appreciate this, it is important to have an understanding of the different types of joint barriers within the body unit. So let's begin there. There are three possible barriers. The first is the anatomic barrier. This barrier is the limit of passive motion imposed by the anatomic structure. Moving beyond the anatomic barrier would result in disruption of ligaments, avulsion of tendons, or fracture of bones. Think of a Jean-Claude Van Damme or Steven Seagal movie. The second is the physiologic barrier. This barrier is the active range of motion permitted by the joint. If somatic dysfunction is present, then a third barrier occurs, the restrictive barrier. This barrier is a dysfunctional limit that narrows the normal physiologic range. It is the restrictive barrier that is sought out and targeted directly with general osteopathic technique. So, how does it work? General osteopathic technique addresses a restrictive barrier, whether articular or fascial, by engaging it with fluid circles and rhythmic oscillation within the physiologic range of motion. This action moves the tissues approximately 4 millimeters and progressively resolves the restrictive barrier, restoring motion within the physiologic barrier range. All right, so now you know how general osteopathic technique works. And remember, as A.T. Still says, an osteopath reasons from his or her knowledge of anatomy and physiology. This has been an episode of the RVU OMM Mechanisms of Action series.